Ronell Nolan, President, CEO, Health Agents for America, HAFA, coming to you live to talk about the coronavirus, politics, and toilet paper. I received an email this morning that the Maryland Exchange was going to have an open enrollment in lieu of the coronavirus to allow those who do not have insurance to purchase insurance through a special enrollment. I have heard some rumblings that CMS could possibly ask the president to create a special enrollment for those on the federal exchange, those states, to allow folks to sign up for an exchange product in lieu of the coronavirus. Those in the insurance business could definitely see how this could cause concerns with regard to adverse selection. HAFA has our finger on the pulse, and we will let you know as we hear of those things that are happening. The agent broker roundtable that was going to be held in Washington next Wednesday is now going to be held virtually due to the coronavirus. So your suggestions, comments are very important and still will be brought to the forefront of those that need to know about the issues that we're concerned about. So please send me an email so I can bring those concerns to the agent and broker virtual roundtable. The Louisiana session started last Monday and is in full go mode. I have heard a couple of things that haven't been clarified yet. One, that there would be someone to check temperature along with limit the doors to enter into the Capitol. And the other thing was to hear as many bills as possible this week to knock them out of either the House or the Senate to move forward and get the bill session rolling as fast as possible in lieu of the coronavirus. I will keep you posted as I hear. My plans are to attend House and Senate insurance on Wednesday. HAFA has not shut down nor closed our doors. It's important that we represent you and the clients that you represent. However, we understand the importance of being careful and all the things that we've heard that we should and should not do. Last week, Louisiana's legislative team had a bill review. There are several bills that look like mandates that we've reached out to the sponsors of those bills and asked the determination. Also reached out to the Department of Insurance to see what their thoughts are, because as you know, with the passing of the ACA, should a state pass a mandate, that mandate must be funded by the state. So the state dollars, the state budget must pay for those benefits. So it's important to determine whether a bill is a mandate or not a mandate. I did talk to the Department of Insurance, and there was a bill that was passed last year that was indeed a mandate, and they are now looking for the state to pay for that bill, for those services, and not the insurance companies. I also learned from the Department of Insurance is that there is a hotline directly to CMS for the states to call and ask for the CMS's determination. CMS can determine whether they think a bill is a mandate or not, and then it ultimately is the state decision to decide if that bill is a mandate. What I also learned was if something is already covered and they're just tweaking that coverage, it's not a mandate. If the coverage is something that was never paid for before, that would indeed be a mandate. So there are some perimeters on a mandate, but something that's very important. And there are bills that absolutely look like mandates. There are two surprise billing bills. One that is very concerning in that it doesn't have enough details. There's so many holes that we are concerned that this wouldn't be a bill that was passed for Louisiana that would help the consumers. People could drive trucks through the holes in this bill. And then the second one is Senator Talbert's bill, that is the department's bill, that has us concerned too because it continuously says emergency services. I did ask at the Department of Insurance bill review, is this just for emergency? They said no, but as we and the team reviewed the bill, it still looks like it's just applies to emergency services. I have reached out to Senator Talbert and waiting for his response on whether this bill is going to help Louisiana or if we're going to continue to have problems with surprise balance billing. There's another bill that should be very concerning to each and every one of you, is concerning on the agent associations and insurance companies. It requires agent groups or agencies of 10 lives or more to adhere to a whole laundry list of cybersecurity guidelines. We feel that 10 employees is too small, that you do not have the manpower nor the funds to adhere to these, and we're asking for an increase of 50 lives and above at minimum. And then there are some guidelines that require you to be responsible for what a third party does. We have some questions on whether you could even adhere to those requirements and guidelines. I did meet along with other agent associations and insurance companies and lobbyists last week with the commissioner and disclosed our concerns. But you need to take a look at that bill. You need to be concerned, especially if you're a small agency, on getting involved, especially if you do not have the manpower to adhere to this new law. Also, the reinsurance bill is back again this year. This would add a $1 per person per month charge to every plan sold in Louisiana. This would go to the individual insurance market to bring the rates down in the individual insurance market. So HAFA's team has voted to support that bill. We would ask that you take a look at it. We do know that Georgia has passed that phase of their legislation, that CMS has approved it. Their reinsurance has federal dollars and state dollars that make the reinsurance fund work. At this point, Louisiana has not found Louisiana dollars to not be able to or not have to charge a per member per month charge to offset the reinsurance. However, this fund has brought the rates down dramatically. If you were at the HAFA Summit, you saw a slide by one of our presenters that showed all the states that it has been implemented, and some states have gone down as much as 44%. So it's something that Louisiana needs to and should look at. Obviously, red lipstick gets all over your face. Should look to and be very involved in. Toilet paper, I still haven't figured out why everyone is buying toilet paper. The coronavirus symptoms are coughing, not sneezing, hard to breathe, and has nothing to do with the toilet paper. So why people are buying toilet paper, I have no idea. But I've had 3 texts this morning from friends that said, I see toilet papers on the shelves. Would you like me to get you some? No, I think I have enough. Plus, I think there's other ways that you could, deal with the issue if you didn't have toilet paper. There's Kleenex. There's all kind of things. But coronavirus, take care of yourself. Adhere to what you're being told. Politics are going forward. There's nothing that is stopping the town hall meetings, the politics in Washington. Things are being shut down. It's not really a good time to visit. But state government, we see state government continuing to pass bills, kill bills, so things have not stopped. And then God knows about toilet paper. Please save March 25th and 26th, 2021 for the HAFA Agent Summit. It will be amazing. We want to make sure you have it on your calendar now, so you're not waiting to the last minute. But I'm here if you need me. HAFA has not stopped the fight. We will not stop the fight. Email me, text me, call me. I'm here for you. If I don't know the answer to your questions, I absolutely know where to go. So have a wonderful day, a wonderful week. Stay safe. Ronell Nolan, Health Agents for America. Until next Monday.